In this video, we are going to see the general outline of the Bony orbit and the bonds forming its boundaries. First, we will describe the orbit with the help of a schematic diagram. Then, we will use the skull to describe the boundaries. The orbits are pair of bony cavities which contain the eyeballs and their associated muscles, nerves, blood vessels and lymphatics, part of lacrimal apparatus and a quantity of fat. Each orbit is a four-sided pyramid with the apex directed behind at the optic canal and the base represented by the orbital margin. In this diagram, we are looking at the orbit from the superior aspect after removing its roof. This is the left medial orbital wall, this is the right medial orbital wall, this is the left lateral orbital wall, and this one is the right lateral orbital wall. The medial walls of both orbits are parallel to each other and lie about 2.5 cm apart, separated by the nasal cavities. The lateral walls, they slope backward and medially and meet each other at right angle. This is the right eyeball and this one is the left eyeball. As we can see from this diagram, the eyeball occupies the anterior third of the orbital cavity and it projects beyond the orbital margin. That is, in this diagram, this is the orbital margin. So it projects beyond the orbital margin so that when a sharp needle is introduced from the lateral margin to the bridge of the nose, it will traverse behind the lens. However, the projecting supraorbital margin and the bridge of the nose prevent a flat surface from striking the eyeball. That was all about the general outline of the orbit. Now we will be seeing the bonds forming the boundaries of the orbit using this skull. So these are the orbital cavities. Each orbit presents a roof, floor, lateral wall, medial wall, the orbital margin and the apex at its depth. We will be seeing one by one. First, the roof. It is formed by two bones, the orbital plate of frontal bone in front and lesser wing of sphenoid behind. Anterolateral part of the roof presents a fossa for the lodgement of orbital part of lacrimal gland. A trochlear notch or spine at the anteromedial angle of the roof, which is over here, gives attachment to the pulley for the superior oblique muscle of eyeball. The optic canal is situated at the extreme posterior part of the roof between the two roots of lesser wing and the body of the sphenoid bone. The optic canal transmits the optic nerve invested by the sheaths derived from the three meninges and ophthalmic artery. Now look at the floor of the orbit. This is the floor. It is formed by the orbital surface of body of maxilla, zygomatic bone anterolaterally and orbital process of palatine bone posteromedially, which is over here. The floor presents an infraorbital groove and canal which transmit the nerve and vessels of the same name from the inferior orbital fissure to the infraorbital foramen. The infraorbital foramen is visible over here. Just lateral to the opening of the nasolacrimal canal, that is over this region, the anteromedial angle of the floor gives origin to the inferior oblique muscle around this region. Next is the lateral wall of the orbit, that is this wall. It is a strong wall and transmits forces of mastication from the molar teeth upward. The lateral wall is formed by two bones, zygomatic bone in front and orbital surface of greater wing of sphenoid behind. It presents small foramina for the passage of zygomaticofacial and zygomaticotemporal nerves. Just behind the lateral margin of the orbit and slightly below the frontozygomatic suture. The frontozygomatic suture is located over this region. Just below the frontozygomatic suture, the zygomatic bone presents a palpable elevation, the Whitnell's tubercle, which gives attachment to four structures: lateral palpebral ligament, check ligament of lateral rectus muscle, suspensory ligament of eyeball, and levator palpebrae superioris muscle. Between the posterior part of the lateral wall and roof of the orbit exists a retort-shaped gap known as the superior orbital fissure, which communicates with the middle cranial fossa. This fissure is bounded above by the lesser wing and below by the greater wing, and its wider medial end by the body of the sphenoid bone. Close to the medial end, the lower border of the fissure is marked by a tubercle, which is over here, which gives attachment to the lateral part of the common tendinous ring. The medial end of the fissure represents the bulb of the retort, and the tubercle at the lower end represents its neck. The tendinous ring provides a common origin to the four recti muscles of eyeball and extends across the fissure to gain attachment to the under surface of the lesser wing around the upper and medial margins of the optic foramen. The superior fissure is divided into three compartments by the tendinous ring. The superolateral compartment transmits lacrimal, frontal and trochlear nerves, superior ophthalmic vein and recurrent meningeal branch of the lacrimal artery. The intermediate compartment, that is within the ring, transmits upper and lower divisions of oculomotor nerve, nasociliary nerve between them, and abducent nerve lateral to the lower division of oculomotor nerve. The infromedial compartment may give passage to the inferior ophthalmic vein. Outside the tendinous ring, the orbital surface of lesser wing gives origin to the levator palpebrae superioris and more medially to the superior oblique muscle. All these features are clearly shown in this diagram. At the junction of the posterior part of the lateral wall and floor of the orbit, there lies the inferior orbital fissure, which communicates the orbit with the infratemporal and pterygopalatine fossae. This is the inferior orbital fissure. The fissure is bounded below and medially by the maxilla, above and laterally by the greater wing of sphenoid bone. Lateral end of the fissure is usually formed by the zygomatic bone. Medial ends of both inferior and superior orbital fissures meet to form a V-shaped extensive fissure. The inferior fissure transmits infraorbital vessels and nerve, zygomatic nerve, orbital branch of pterygopalatine ganglion, and communications between the inferior ophthalmic veins and pterygoid venous plexus. Now we will see about the medial wall of the orbit. It is the thinnest wall and extends from the anterior lacrimal crest on the frontal process of maxilla to the optic foramen, which is located over here. This is the medial wall of the orbit. The medial wall is formed by 4 bones from before backwards. They are frontal process of maxilla, the lacrimal bone, then the orbital plate of the ethmoid bone and body of the sphenoid on the posteriormost part. The lacrimal bone presents a vertical ridge known as the posterior lacrimal crest. A lacrimal fossa intervenes between anterior and posterior lacrimal crests. It lodges the lacrimal sac, which is continuous below with the nasolacrimal duct. In this bone, a piece of the bone is broken over this region, and this is the region where the lacrimal sac is continuous as the nasolacrimal duct. The anterior and posterior ethmoidal foramen, which is over here and here, lie at the junction between the medial wall and the roof of the orbit. They transmit vessels and nerves of the same name to the anterior cranial fossa. Next, we will see about the orbital margin. It forms a 4-sided curved margin and is contributed by the frontal, zygomatic and maxilla in nearly equal thirds. The supraorbital margin formed by the frontal bone presents a notch or foramen which transmits supraorbital vessels and nerves. This notch or foramen is present at the junction of lateral 2/3 and medial 1/3. Traced medially, the upper margin is continuous with the posterior lacrimal crest. The infraorbital margin is formed by the zygomatic bone and maxilla in equal halves. When traced medially, it is continuous with the anterior lacrimal crest. The orbital septum derived from the orbital periosteum is attached to the orbital margin and posterior lacrimal crest. That was all about the bones forming the boundaries of the orbit.